Hello, welcome to Ochsner Medical Center. This is insane that we're even doing this right now, that we can stream and broadcast like live to your screens over there into high schools. We didn't have this kind of technology back when I was in high school, which was like 7 or 10 years ago. Kind of sounds a lot longer when I say it out loud, but we didn't even have like iPhones. Like we had flip phones back then. So it's crazy how technology is so rapidly changing, and it's affecting our lives, at home and at work or school. It's improving our lives. It's making things easier, and it's helping us do things easier and quicker. And that's even true here. So we just got like a brand new instrument. You're going to see it soon. It's like huge, but it makes our job so much better. So my name is Kelvin, and I'm a medical laboratory scientist, and technology is at the core of what we do here at Ochsner. And I'm going to give you a little behind-the-scenes look at what happens. So most people only know the front side of healthcare. And that's going to be, when you think of a hospital, you think of doctors and you think of nurses, or maybe you broke your leg and you call like the x-ray tech who went and x-rayed your knee, or your family member went to go get routine blood work done, for a routine checkup. And that would be the phlebotomist that would draw that patient. That's basically what most people know about the healthcare system. So today we're going to get a little behind the scenes on that. We're going to find out what we as medical laboratory scientists do. And it all starts here. So we're going to pick up where you leave off. So right here, we have a patient right now, Mr. Dedivo. He's getting his blood drawn, and Miss Anita here will be drawing his blood.
Good afternoon, Mr. Dedivo.
Hi.
I'm Anita. I'll be your tech for today. Could you tell me your first and last name and spell it for me?
Sure, it's Kenneth Dedivo, Kenneth, Betiveaux.
Okay, and then happy birthday.
7/2/64.
You see, she's checking patient identification. Following standard protocol, she's cleaning her hands and using protective equipment.
Okay. Which arm would you prefer?
I think we'll go with the left today.
Let me set you up, and we'll get started.
And there's rules and there's safety precautions that we have to take. It's with every test and at every step that we do here at Ochsner. All the laboratory testing that we do, it all has safety regulations. It's all spelled out.
Okay, Mr. Dedivo, we're going to tie you a little tight for a minute, okay?
Okay.
All right, so just going to put on the tourniquet.
Is that comfortable for you? Okay. Well, we get it through there. We're gonna clean you. And hold your fist tight for me. Can we
She's going to put in the needle and start drawing the blood into the tubes. Now we have different types of tubes for the different types of tests that they want to do on the patient. And as we go on, we'll see where these specimens go.
You okay?
Mm-hmm.
So for instance, like the purple top that she drew will go to our hematology lab. The blue top will go to our coagulation lab, and the green top will go to our chemistry lab.
Hold that 1 second for me. We're gonna label your tubes. And I'm gonna need you to check one.
Yes, ma'am.
So this part is very important. She's making sure that all the tubes are properly labeled and that the labels match who the patient is. We always use two patient identifiers, so it's usually the person's name and their date of birth.
Okay, Mr. Devon, I'm gonna wrap you and you just keep this on for at least 20 minutes, okay?
Yes, ma'am.
Okay. I need you to make sure this is your name and your date of birth.
That's correct.
Okay, anything else I can do for
No,
you?
ma'am. Thank you very much. You did a great job.
Well, thank you, and thank you for choosing us.
Thank you.
You too.
Great. And from here, we'll see where these specimens go.
Alright.
Ms. Anita, you did a wonderful job. Thank you.
Well, thank you.
All right. So here we go. We're going to take the specimens. We're going to go down the hallway here to the central specimen receiving lab, and from there they'll sort which one of these tubes and where they go. And the first lab that we'll go to is we'll bring his Mr. Dedevo's purple top tube to the hematology lab. So we're going to go in this way.
Look, Gretchen, I have a steady D. Thank you. To run a stat ED, this is what we need to do. We'll press this button right here, and it opens up. A complete blood count will give us a white blood cell count, a hemoglobin, a hematocrit, and a platelet count. It'll also tell us the different types of white cells that are in our body. Now, while this is running, I was working on a patient that I needed to ask the pathologist a question.
These cells definitely look like they're abnormal, and they're from a patient that possibly could be leukemic. So what I'll do is I'll take the blood specimen and I'll bring it to flow cytometry for more immunological testing. So thank you, Gretchen, and I'll get in contact with the patient's doctor.
Thank you for explaining that to me. And now I'm sure my stat ED is done, so let's go see what those results are. Okay, from the looks of it, it seems that we have a critical hemoglobin and hematocrit. So I need to get in touch with the ED nurse and the blood bank to let them know that we need to give this patient blood.
All right. So while she's doing that, we're going to go check on chemistry and see what they're doing over there. We're back over here in central specimen receiving. You can see some of the delivery tubes that we have where they send in some of our specimens. I think we're getting one right now.
This is a steady D.
Thank you.
Patient came into the ER complaining of chest pain. The doctor would like to determine if the patient is having a heart attack. So troponin was ordered. A troponin is a heart enzyme that increases during a heart attack. So the tech puts the tube on the track system and we'll follow the tube around the track. The track system is just used to transfer the tubes to different areas. The first area that we see is one of the centrifuge, and it spins the blood at a high rate of RPMs, and this separates the blood cells from the plasma to do testing. This area is our storage unit. It's like a great big refrigerator, and about 20,000 tubes are kept in here at a time in case we need to do any further testing. So around the track, each tube will go until it reaches one or more of our 7 analyzers. Our analyzers run about 18,000 tubes in an hour, and we perform 120 different chemistry tests. We perform about 11 million tests a year. And the chemistry analyzer uses a photometric and electrochemical measurement to determine concentrations of analytes. Some common analytes are going to be calcium, potassium, sodium, iron, cholesterol. And of course, these tests are used to treat and diagnose different diseases. So those diseases are going to be like diabetes, anemia, cardiac disorders, liver disorders, kidney disorders. Some of the other testing we do are toxicology testing, and that would be THC, ethanol, opiates, and of course those are used for drug abuse. We do therapeutic drug monitoring, and that's going to be a drug like antibiotics. Antibiotics are used to help treat infections, and so we have to monitor to make sure they're getting the correct dosage. We also test for hormones here. Those are going to be things like FSH, estradiol, LH, TSH, and of course pregnancy hormone HCG. We also are involved in liver transplants. We do a lot of organ transplants here. We do an intraoperative blood testing for someone that maybe is in surgery, but they want to make sure they monitor the patient's status throughout the surgery. We're going to hop on over to urinalysis. Urine is another fluid that is we perform tests on. Okay. So a patient came in and they complained of painful urination. So
they put the urine through and it flagged for some WBC and some bacteria. So here you can see on the screen we have some white cells and some bacteria that are laying around. So this sample is going to have to go to Michael for a microbiology or a culture. My hand is
Okay. So we're going to take the urine culture and we're going to bring it to the microbiology lab. All right. Here's our urine culture. What we just left was the core laboratory, which is made up of hematology and chemistry, those two sections. They also have a lot of other labs that are in that same part of the hospital. So we have things like COAG, which we do testing to find about clotting disorders or bleeding disorders. We also have immunology, which includes flow. I remember that patient that we had where they found the leukemia. That would go to flow cytometry section of immunology, and they would do special testing to find out, they would see different markers on the cells to find out which specific type of leukemia it is. As you can see, chemistry measures the different analytes, as Tracy talked to you about, like sodium, potassium, electrolytes. Hematology, what we do is we basically, it's a little less automated than chemistry, but we see how much cells that someone has in their body, their white, their red count, and we're able to distinguish and figure out what types of white cells that they do have. So we perform what's called a differential, and we perform that on a microscope. What I went through was a 4-year degree, and then I got into the program, which was about 1.5 years to 2 years. You really don't need to do like the 4-year degree. For me, I didn't find out about this career until a lot later in my schooling. So we're a really in-demand job, and you know the problem is that we just don't have the exposure. So once we get the exposure, that's why I'm here. So we're here at Microlab, and we're going to hand off the specimen.
Hello, welcome to Micro. I'm sure you've seen other parts of the lab, and while most of them deal primarily with blood or fluids, we deal with anything that can come off of or out of a human being. It's really stinky. That's right, folks, I'm talking poop. We also get blood culture bottles. This is looking for septicemia or infections in the blood. We, when we receive the specimen, just like we got the urine, we take it and we put it onto media plates. Each of these are selective, so certain bacteria will grow on it, just like this. So The urine that we just got, let's say this is it, and we plate it, it's incubated for 24 hours, and you'll see this right here is E. coli. Pretty. We take one colony from here, and we put it onto our quick ID system, MALDI. This gives us an ID within a few hours, where before it used to be 2 days. We also send it to Microscan. When we go there, it's on a plate like this, and it's testing it against different antibiotics. So we're able to give doctors an ID and let them know exactly how to treat whatever bacteria is present. We also do stains. This is a gram stain. Can't really see it. This gives a preliminary ID. We can tell if it's a staph or if it's a negative rod, like an E. coli. It's just an extra way to give a doctor a heads up on how to treat. We also do STD testing. Remember that. Remember this swab. Alrighty, so we do STDs, we do bacteria, we deal with fungus, we deal with tuberculosis, and some viruses. Whenever you go to a doctor and you get a throat swab done for strep, it gets sent to us. So we use a kit, and we also do a culture. And this right here is strep throat. So that's primarily what microbiology does. We are the ones that give IDs. We tell the doctors what the infection is and what drugs they can give you to treat. So this is the first part. This is setups. This is where all of the specimens are plated and put onto the appropriate media. The blood culture bottles that I showed earlier, they are then put onto these machines in the back. It constantly rotates them and it incubates them, and a laser shoots through the bottom of the bottle, and it registers CO2 levels, because if there's high levels of bacteria, CO2 rises. And it'll form, I guess that's how it's called. It sounds like that. So we can't ignore that. This is where we do stains. As you can see, we have machines for everything. Everything is tested. So once the specimen is plated, it's then put in the incubator for 18 to 24 hours, and it's sent here to the benches. Each bench is responsible for working up a certain type of culture. This is where we put the bacteria onto that plate to get the ID. It's also where we go ahead and set them up for the antibiotics as well. When it comes into this room here, this is Microscan. So this is where that tray is, where we get the readout for the antibiotics. It goes and it's put into this machine for 24 hours. With bacteria, as they call it, or microbiology, nothing is quick. Everything has to incubate. It takes its time. We incubate so much stuff that we actually have a walk-in incubator that's usually filled to the brim with all kinds of cultures, and it smells really bad. And then on this side, this is where we send for the quick ID on this machine right here. That's the MALDI that gives us that ID within a few hours. This machine back here, that's where we do STD testing. And then we also, right here in a separate area, test for acid-fast bacillus or tuberculosis. That's the most common one that people know. So we test that here. We work under hoods for everything so that we don't get infected, because there's always that possibility. But that is it. That's just a quick tour of everything. So micro is bacteria, and it's smelly, and without us doing this, doctors can't treat infections. So It's very important to the lab and it's very important for treatment.
All right, so you just saw the microbiology laboratory. We're going to take you to the blood bank right now. We're going to check on that ER patient that came into the hematology lab earlier, the one that was in the car crash and he's bleeding out. So we're going to go cross-matching the blood to make sure they have the right blood type for him. And like I was saying, this is a very in-demand career because we don't get a lot of exposure. A lot of people don't know about us, so we don't get a lot of people that come in. You know what in-demand career means? That means higher wages. So it's a good opportunity. Oxygen is a great place to be with great benefits. Here we are in the blood bank lab. We have a security door here that's one way to keep everything protected. And I'm waiting for security to let me in through the door.
Hey, welcome to Blood Bank. My name is Cal. I'm working in the blood bank, and so what I'm doing today is showing you what blood bank is about. So what we normally do is we get these sample. It's a sample we use to do cross match, and before we do anything, we want to spin the sample down for 5 minutes. And this is how the sample looks like. And what we test is the serum. And these are our inventory right behind you here. See all blood products. Looking all our A's and our O's. Before we even run anything, we will want to do a typing screen. And what a typing screen is, a type is a blood type you want to do before you know what kind of blood type the patient is, and the screen is an antibody screen just to make sure the patient don't form any antibody or issue any blood. Because say, for a good example, you're an A patient and you receive blood and you have an antibody. An antibody is something you form where your body is negative for that antigen. And to get antigen negative blood, we have to test our donor units to make sure it's negative. So that's what the antibody screen is for. And to do those, what I normally do is we have these test tubes. That's where we run our tests in and doing our cross match. And the serum I was telling you about, this clear, I don't know, you can see it. There you go. So these clear serum right here is that what we use to do our cross matches on. So we're going to do 2 drops of those and 1 drop of our red cells. And when we do red cells, we're going to do a suspension in saline where it's not so thick. So when we're doing that, we're going to put in our centrifuge here. So we're going to spin that for 15 seconds to see if it got any agglutination. So if there's agglutination, that means the blood is incompatible in your body. So if you see any kind of agglutinin in the tube, that's pretty much what we're doing in the tube is what is mimicking your body. So if it's agglutinin in here, you don't want that to be in your body either. Because when it's agglutinin in your body, so it's pretty much all your blood going freezing up in your vein, and you don't want that to happen.
All right, so we're going to take you now to the stem cell lab, which is in our blood bank lab right here. It's right down the hallway. So this is our stem cell lab. Danny will tell you more about what's going on around here. Hey, Danny.
Hey. Hello. This is our stem cell lab. In here we assist doctors and nurses help cure patients with blood cancers. So we collect stem cells, we process, and then we actually store the products. We have to store them in liquid nitrogen in order for them to preserve until the patient's ready to be transplanted. So they're actually stored in these metal containers here. And then once the patient is ready to be transplanted, we bring these products up to the patient's room and we thaw them out in a water bath, and they're actually given just like they are a blood transfusion. And then hopefully the patient will engraft and they actually are cured of those leukemia or lymphoma cells that had been previously in their blood system.
All right, thank you, Benny.
You're welcome.
So, as you can see, we have many different laboratories here at Ochsner, and they all work together so that we can work to change and save people's lives. That's our goal here. That's our main objective. That's what we're here to do. And so we all work together in order to provide timely and accurate test results so that doctors can make the best possible diagnosis and treatment for their patients. Right now, we have a team of experts here, a panel of them. So if you have any questions, feel free to send them in, and we'll do our best to answer them.
I have a few questions to get started. So one question I had, first of all, pretty amazing, all the different places we visited. How do you keep track of where things are? Not just like if I pick up a vial, I know who it belongs to, but how do you know how do you keep track of all that so the doctor knows when everything's going to be back for information to go to the patient?
So we have the medical record number, and through our LI, we can type in the medical record number, and it can tell us what tests have been done, what tests are in process, and what tests need to be done. And the doctor, when the test is done, it gets sent the results get sent straight to the doctor through his email, so he'll know when the results are done to give to the patient.
So every station gets a scan, basically.
Yes.
Okay.
Yes.
Very cool. And then you went through a security door when you went to the blood bank. Is there security doors everywhere? We just only saw one, or why security on the blood bank and not the other ones, I guess?
So the reason that the blood bank has to have security on the doors, we also have cameras here, is we have an instrument in the lab that irradiates blood. And in order for it to irradiate, it actually has a nuclear source. And so we have to be extra cautious that no one tries to steal that to make it a weapon or anything. So that's actually why we have so much security in the blood bank.
Oh my God, that's totally awesome. One more question, and hopefully we'll have some from the classrooms. So there are a lot of stations that seem like somebody was sitting at a station doing a very specific task. How often or how much are you all able to move around from station to station and do different tasks? Or how much are you siloed into a station? Can you talk a little bit about some of the opportunities there?
We are all trained in almost all the stations. So from day to day, we have a schedule, and you could be on a different station every day of the week.
Okay, thank you. So questions from the classroom?
How long have you all been in the medical field?
I've been in Tulsa for over 25 years.
Wow.
I've been 4 years.
11 years.
40.
And I haven't even been here but 6 months.
About 20 years for me.
25 years.
All right, any questions from Mr. Holland's classroom?
No, sir.
All right. Josh, any more questions on your side?
And if you all think of questions as time goes on, please feel free to email the academic outreach account, and we will forward it along to our laboratory professionals, and they can go ahead and answer that for you.
So I do have another question. You were mentioning about your educational background. What kind of pathways do you get to be where you are? Is there associate's degrees, bachelor's, master's? Are there just certifications? Can you talk a little bit about that?
Okay, sure. To get from where they are and where we are, there is an associate's degree. There is a bachelor's degree. I think the associate's is roughly about 2 years. A bachelor's can run about the same. The program that I went through over at LSU Health Sciences Center was 1.5 years. Well, okay, 4 years for the bachelor's degree. They also require prerequisites also. I had a 4-year bachelor's degree for that, so that filled the prerequisites, but that's not completely necessary. But those are our two main sections. I think there's supposed to be a master's or a PhD.
There are 2 PhD schools, one at Rutgers and one at in Galveston in Texas. They're brand new. They just started, and we just recently had a graduate from Rutgers in Shreveport, Louisiana. She recently graduated about maybe earlier this year and got her PhD in clinical laboratory science. So there are 2 PhD programs now.
What would you do if sample spills or a lab worker comes in contact with a sample?
Well, we have spill kits, which there's a process and there's chemicals that we put on the spilled blood, and we have to wait so long, and then we clean it up. So everything, we have a face mask and gloves, and of course our lab jackets on.
So what drew you to the profession? So I know there were some comments about sometimes you're behind the scenes and you're not as known as much as some of the ones that are up front. So how did you find out about it? What drew you to the profession?
For me, I just think, I liked science and math and always wondered how things worked in the body and just how to help that way, I think was my reasoning.
I believe that's probably the reason for most of us that we really like math and science. And honestly, most of us probably have a degree in biology already and either didn't really want to go to medical school to be a physician, but we wanted to be in healthcare and in the medical field and really didn't want to be nurses. So we just kind of stumbled upon laboratory science. Maybe someone told us, or maybe we knew a nurse or something. So that's kind of how probably most of us found out about it.
I'd agree with that.
And then what are sort of the salary ranges?
We have that.
We have that information.
So there's a couple of levels that you can do, like a phlebotomist, the person who drew the blood. Their range is between $23,000 and $34,000 a year. Then you have a laboratory assistant who does minimal laboratory testing, and you need a license for that, at least here in Louisiana, which is $28,000 to $42,000 a year. Then you have your associate's degree, which is a medical laboratory technician, which is about $34,000 to $56,000 a year. And then you have your medical laboratory scientist, which is the highest level you can achieve, which is $45,000 to $73,000 a year.
Wow. If I could just add something, I know you mentioned about certification and licensure. So for those bachelor's and the associate's degrees, you do need a licensure in the state of Louisiana. Not all states need it, but we need it here. And we also take a test to be certified by the ASCP.
And just to add on, these are ranges for our region in Louisiana. Different regions are going to be slightly different, just depending cost of living and such.
I was laughing that the one woman was talking about how stinky her job was.
Yeah.
I think. So what is the favorite part about your job?
I would say helping patients. Even though we are behind the scenes, it is really nice to know that we are helping patients. We are helping the physician diagnose the patient and getting those results to him or her quickly, and knowing that they can make quick diagnosis and treat the patient appropriately.
Yeah. I mean, we see the names on the paper, and we know what we're doing affects that, and so it's just it's a really great motivator. It's something that keeps me coming back here. I love it.
I know that you guys have spent a lot of time preparing for this. This was an amazing journey. It's truly amazing. I was like, anyway, what last things can you say to the kids about your life, about how to get interested, where to go from here? Any last minute advice for them?
I would say, if you're like us and you like math and science, I know that when I was in high school, those things weren't easy. They were hard for me. And there was a lot of times when I faced challenges and I felt like, it's something that I couldn't do, and I thought about giving up on it. But it's dedication and motivation. If you want it, you got to stick to it, and you'll overcome it. You'll get through it, and you'll get to be where you want to be. This is a great profession for people who want to help people in a healthcare setting, and maybe just don't want to be a nurse or a doctor, or like working with the technology that we have here.
I would definitely have to agree with that. I truly enjoyed biology as a high school student, and I speak for myself, but I'm sure everyone else. I was such a nerd, and I loved working on science fair projects. So just go for it. Just if you want to do something, find that mentor that's going to help you achieve your science and math goals, and you'll be just fine.
Well, thank you very much. Really appreciate it. Thank everyone who's not on the screen right now, because I know there's a lot of other people that were doing this. You guys have a great rest of the week, okay?
Thank you very much.
All right, take care.